Ireland's Classic Hits Radio, it's Trina Mara, and we welcome Michael Terberg to the show today from Thomson Screening. And I want to talk to you about vision and hearing impairment, Michael, and the massive effect that this can have on educational outcomes and behaviour when it comes to children. I didn't realise there is an actual rise in the amount of children with visual impairments and hearing impairments.
Well, there's certainly been a rise on visual impairments, particularly related to what's called myopia, which is called short-sightedness. And this was already evident before the pandemic. It's believed to have been associated with increasing time spent looking at screens, like particularly smartphones and laptops, but smartphones with children in particular with eyes close up to smartphones when they're very young. You often see children even in a pram with a smartphone. This can have effects on short-sightedness in particular. It's also linked during the pandemic and indeed since, due to lack of time being spent outside playing by children, just being indoors too much. On hearing, it's not been an increase in hearing, but hearing has a major implications both for developmental progress and indeed behaviour, learning, across everything really.
Wow, that is interesting about using the smartphones and the iPads and everything. You do see it all the time. You see babies in prams and they're looking at these. Getting your children assessed is really, really important. How do most people detect it? I mean, is it normally a matter of the parents notice that they're squinting a bit, and when it comes to the hearing, sometimes you feel like your children have a selective hearing. So how is it that parents realise, okay, there's something up here?
Yes, I think adults can be accused of selective hearing as well. Obviously, parents and teachers need to be aware of this. And now many parents and teachers many aren't, and all have a lot to do in their daily lives. It is something that a child, particularly the younger they are, let's say under about 12, 13, are unlikely to be aware of themselves because they will be seeing their lives as normal. The fact that they can't see or hear something, and that can obviously lead to issues to do with development and learning as well. And certainly, as I'm from the UK, I'm not too aware of how things are done in Ireland, though I believe there is some vision screening carried out on very young children. I'm not aware. We have been approached by the Irish Health Service for a general discussion about hearing screening, and I think they're having a bit of a look at it. But I'm not aware of any particular programs being done by the Health Service.
It seems to happen, actually. The testing seems to happen once they start school.
Yes.
But before then,
Good.
There's nothing really, because my own daughter started wearing glasses. I think she might have been 3.5 or 4 and didn't start school till 5. So by the time that appointment came up, she was already in her glasses.
Yep. Yeah, well, that's very, very common. And the other issue is it's great that the screening is done at reception, but the other issue is that children's eyesight and hearing can change as they grow. We use webinars run quite recently by a major publishing house in the UK for teachers, including our clinical advisors for vision and hearing and teachers. And it's very clear that teachers do see a continuing problem above that early age. Clearly catching things as early as possible is essential. In other words, in the UK, there is a national newborn hearing screening program, so that's at 10 days. There is a poor correlation between that and when children start school. In other words, there's still many children, if they get hearing screened, which is relatively rare, but we think about 20% in the UK, that there's still a lot that fail their hearing screen. And then what happens afterwards doesn't happen unless you take your child to your GP or to, I guess, a high street optometrist and get them checked out.
You have to kind of take matters into your own hand as well.
You have to.
You do. The other thing is sometimes you wonder during these screening tests, I think a lot of parents are almost in denial and they say, they're just not paying attention. It's not that they can't hear it, it's that they're not paying attention to it, which I'm sure can happen sometimes when you do the hearing tests.
It can. I mean, it is down to the parent and also the communications with the parent. The reason you're interviewing me is that our software is widely used in England, particularly in the National Health Service, at that reception area. So they go in using non-clinicians and use our software to check out the children. The big issue, actually, for doing the screening is the communication with parents, is the communication with the schools. It sort of falls between stools. In England, and our software does automate all that. So in a school or indeed in a health service, the parent gets informed automatically and has a pathway either to the high street optom or to the GP or the clinic. So it really depends how it's organised in Ireland. There is nothing after 5 in the UK like in Ireland, and that's a big issue because it's mainly mild to moderate hearing and vision problems which are the issue regarding children's development, because if the child has a very significant problem, it's highly likely that'll be noticed.
And then how does this impact you into adulthood if it's not caught and not being treated, with glasses or with a hearing aid?
Well, that's a very interesting question. There has been various pieces of research. I don't want to put too terrible a slant on it, but the National Learning Trust in the UK did research a few years ago on prisoners, and the fail rate for vision and hearing is kind of off a scale in prisons. And it's kind of not too surprising. And not saying that if someone got screened aged 8, they wouldn't go to prison. But it is an issue that is fundamental to development. And it's really doing these simple things that can help hugely in adulthood. Intriguingly, there's also research that shows that if a child is clinically overweight when they're younger, they can have hearing problems in middle age. So there's all bits and pieces, but very often they're not joined up.
And I think I read somewhere that hearing loss can be connected to dementia as well.
Well, I'm not an expert on that area. Many things can be connected. But let us say that any sensory stimulation that the person is not getting, hearing being obviously one of those, must affect development in the brain. Yeah. And so I would not be surprised if there's some factor, but it really is way above mine and my colleagues' pay grade to comment on that specific.
Yeah. Well, there you go. Very, very important to make sure that your children are screened for their vision and their hearing, because you might not have realised it, and it could be having a serious effect on their behaviour and their educational outcome as well. Thanks so much to Michael Terberg there from Thomson Screening for taking our call. Thanks, Michael.
Thank you very much. All the best.
Thank you. It's Ireland's Classic Hits Radio.